Chiropractic versus physical therapy. In a previous video, I discussed chiropractors versus physical therapists from the consumer perspective, especially as it related to back pain and managing spine pains and spine conditions. In the comments section of that video, I was asked to share my personal story of why I chose to become a chiropractor instead of a physical therapist. And this was from a gentleman who's trying to decide between these two different career paths, and he wanted help making that decision. So if you are a chiropractor or a physical therapist watching this video, I would ask you to leave a comment below. Let's help this gentleman out and anybody who's watching this video trying to decide between these two career paths. Now, as a recap to my original video, chiropractors versus physical therapists, from the consumer perspective, pretty much what I said was that traditionally, chiropractors seem to focus more on hands-on manual therapies, especially spinal manipulation, and they kind of embody this idea of, I'm a healer that uses my hands, and they definitely had more of this holistic approach. They believed that their hands-on therapies, especially spinal manipulations, were good for the body overall, not just for helping with musculoskeletal and spinal pain. And they had a greater emphasis on just wellness in general, maybe prescribing supplements and things like that. Physical therapists, on the other hand, traditionally, not all across the board, but traditionally, were more focused on active care, strengthening, stretching, mobility, and in particular, trying to help people manage any musculoskeletal condition. It could be hip pain, shoulder pain, and of course, spine conditions. Now, then what I went on to say was that, in the past decade, things are kind of merging together. There are more and more physical therapists that are doing spinal manipulation, acupuncture, cupping, soft tissue work, and they're finding a tremendous amount of value in those therapies. There are also a lot of chiropractors that are prescribing exercises and recognizing the benefits and the value of active care to build a resilient spine. So really what I concluded at the end of that video was it's probably less about trying to decide what's better between a chiropractor or a physical therapist as a profession, but finding the right therapist for you that will work well with you, because there are excellent chiropractors and physical therapists, and there are less than stellar chiropractors and physical therapists. Now, to answer the original question, why I personally chose to become a chiropractor instead of a physical therapist, I would say the biggest reason is I was just exposed to somebody who was studying to become a chiropractor, and I didn't know any physical therapists, and I had I would say almost a profound experience with these manual therapies. So I got out of the Marine Corps way back in 2001. And when I got out, I just had your typical aches and pains that you would expect after 4 years of being in the Marine Corps. And I think I was doing roofing at that time. So just hard labor, Marine Corps. I played sports like rugby and, Muay Thai, kickboxing. So I just had this tendency to beat my body up. And I was hanging out with a family member, a cousin. He was studying to become a chiropractor, and I must have mentioned something. He manipulated my spine. He was working on muscles, stretching me out. And when he was finished, I felt so good. I just felt freed up. And it made me think maybe this is a career path I would want to pursue, because I was already interested in natural methods of healing. I was interested in biomechanics, manual therapies, rehabilitation, athletic training. This was just a field I was already interested in. And because I knew this person and he had a lot to say about it, I slowly went in that direction. But I don't think it was because I had this thought chiropractors are better than physical therapists. I think it was just I had this experience. It felt really good to me. It was valuable and beneficial for me. And I knew this person and I didn't know a physical therapist. So that's probably why I made that decision. So once I committed and I decided I am going to become a chiropractor, I went to Logan University, and my chiropractic college experience was mixed. On one end of the spectrum, there were excellent courses, neurology, there were biomechanics. We get to study how acupuncture really works, like if you take the philosophy out, and the hands-on section, like how to actually become a healer and use your hands to do these things, I think is going to be much better at a chiropractic college, potentially. On the other end of the spectrum, there were required classes, required coursework that I think was a little too woo-woo, a little too mystical. And this is from a perspective, at that time, I was really interested in mindfulness-based stress reduction, meditation, yoga. But some of this coursework was just too far mystical and I think outside of the realm of evidence-based. And some of the times they placed this overemphasis on spinal manipulation. They almost try to make it seem as though this was this magical treatment that could heal anything. And it just didn't resonate with me. And I think that's why sometimes you still have chiropractors even today that have this overemphasis and this, I think, this false sense of how powerful a spinal manipulation is. And that's all they do in their practice. And I think it's unfortunate because we learn so much, but sometimes if somebody gets a little bit stuck in that path of spinal manipulation, it cures everything, it fixes everything, it can heal anything, then you're kind of stuck in this pattern of that's all I'm gonna do. And a lot of times people need a more broad spectrum approach to health and wellness. So now finally, let me close with what I think are the pros and cons if somebody wants to go down that career path of a chiropractor versus a physical therapist. And I'm gonna start with job security and money because I think that's important for a lot of people. And I would say if job security and being able to get a job as soon as you get out of college, probably a physical therapist is the way to go. There are just many more opportunities. There are opportunities to work in a hospital setting, to work in a clinic setting, to get out and start your own business. So and you're working with a much wider variety of conditions. And you're very specialized in whatever that condition is that you're gonna work with. Whereas as a chiropractor, we're not as well accepted in the medical community and even just the community at large. We're still this little niche thing that we do for complementary alternative. And so because there aren't as many opportunities, you're really stuck with, you kind of have to go out and do your own thing. There are opportunities to go out and get a job, but they are very few. So you have to get out and start your own business a lot of times. And because you have to do that, there's a lot of stress. It's hard to get going. It could take years and years and years before you really get up off of the ground and get lifted to do that. Now, on the other end of that is because you're forced to go out to do that, chiropractors can sometimes make more money. Sometimes when I'm gonna work at this job, your income is a little bit capped. Here's about how much I can make. Whereas if you have to go out and grind and start and set up your own business and your own practice, well then you have more of this potential to become your business owner, maybe hire other chiropractors. Do what I did is I find the value of physical therapy, personal training, and combining these things. So we have a performance and recovery center, where we offer chiropractic, acupuncture, massage, soft tissue work, and we offer the personal training and the physical therapy. So you could go out and say, okay, I'm gonna start this business and do more, but I think it takes a really long time, a lot of stress. From my own experience, a tremendous amount of stress. So sometimes, the first 10 years, I felt like, gosh, I would do anything to have a job. And then now that I am where I am, it's like, I'm kind of happy I had to grind because now I have more autonomy. I get to create my own schedule. I get to practice how I want. And that actually brings me to another point, chiropractors versus physical therapists from a career path perspective is insurance. Insurance usually reimburses better for physical therapists. So there are more opportunities to see more people and potentially make more money. But again, on the other side of that is most people don't like accepting insurance because you're bound by their rules, their regulations, a tremendous amount more paperwork. It almost feels like you're working for the insurance company more than you're actually healing clients and working with patients. And the burnout rate is really high because you're stuck in this box. And you have to do things precisely how they say you do things. Whereas when you don't accept insurance, you get to focus all of your energy and efforts to taking care of people and the patient, and you're putting their best interest at hand, not trying to do things the way insurance companies want you to do it, dealing with denied payments and things like that. So hopefully that helps you out, or anybody that's trying to decide maybe the difference between becoming a chiropractor and a physical therapist. Again, if you are a chiropractor or a physical therapist, please leave a comment below, because I'm sure there are things I missed, and you probably have a lot that you could offer some of these people looking to decide between these two professions.